Hello, I'm Dr. Jerry Jones. I teach advanced electrocardiography at Medicus of Houston. Today I want to talk to you a little bit about some misinformation I found throughout the web regarding third-degree AV blocks. So let's get started. Let me begin by saying that there are some excellent, reputable, and very dependable websites and YouTube videos about electrocardiography. Unfortunately, there are some that are produced by people who have little or no true understanding of electrocardiography or ECG interpretation. I've created a few short videos to give you a heads-up warning that you may be visiting such a site or viewing such a video. Now, today we're going to discuss the confusion between AV dissociation and third-degree AV block. Now, how do you define third-degree AV block? If you answered, the P waves and the QRS complexes have no connection with each other, then you've been a victim of misinformation. So what causes all the confusion? Well, the problem lies in the recognition of AV dissociation that is not caused by a third-degree AV block, and the recognition of AV dissociation that is caused by a third-degree AV block. One is quite benign, while the other demands a permanent pacemaker. Okay, it's time for you to decide. Both strips exhibit AV dissociation, but one is due to a third-degree AV block, and the other is due to interference by a junctional escape pacemaker. Which is the third-degree AV block? A or B? Now, I want you to pause the video at this point and think about your answer, and I'll return in a moment with the discussion. Okay, did you have a chance to come to a decision? Well, here's the response. A is the third-degree AV block. The ventricular rhythm in A is perfectly regular, without any interruptions. Why is that? Well, its regularity remains uninterrupted because the level of the escape pacemaker, in this case likely a ventricular pacemaker, is below the level of the AV block. Nothing can get past the block to interrupt this regularity of the ventricular rhythm. The ventricular rhythm in B is visibly irregular. Now, why is that? Well, from time to time, a sinus-conducted impulse is able to get through the refractoriness and activate the ventricles. So we have occasionally QRS complexes that appear sooner than expected. AV dissociation can be present with or without a third-degree AV block. Now, do you see why defining third-degree AV block as P waves and QRS complexes that are not associated is very problematic? How can we distinguish one from the other? Well, it's actually quite easy. In deciding whether AV dissociation is due to a third-degree AV block or something more benign, there are four things you need to consider. One, the ventricular rhythm in third-degree AV block can only be interrupted by a PVC or PJC, and this would be a rare event. The ventricular rhythm, whether due to a junctional or a ventricular escape pacemaker, cannot be interrupted from above because the pacemaker is located below the AV block. Two, in a third-degree AV block, there will be P waves in areas of diastole that should have allowed conduction, but they did not conduct. Three, in a third-degree AV block, the atrial rate is almost always faster than the ventricular rate. Remember, the ventricular rate refers to the junctional as well as ventricular pacemakers. And four, with AV dissociation without a third-degree AV block, one can easily see why the non-conducted P waves fail to conduct. Now, here are a few pearls I've included for you. It's easy to determine which pacemaker, atrial or an infranodal pacemaker, is faster. If there are two or more P waves between the QRS complexes, the atrial pacemaker is faster. On the other hand, if there are two or more ventricular complexes, i.e. QRS complexes, between P waves, the ventricular rate is faster. Now let's consider something else. Look at these P waves, the ones with the red arrows. These P waves are in areas of diastole that should have allowed conduction to the ventricles, but they didn't conduct because they were blocked. Now for pearl number 2. A ventricular escape rhythm interspersed with shorter RR intervals indicates AV dissociation without an AV block. Now let me repeat that. A ventricular escape rhythm interspersed with shorter RR intervals indicates AV dissociation without any AV block. Now here we have a ventricular escape interval. This is the rhythm of the, in this case, a junctional pacemaker. Here we have a short interval. Now the two arrows are the same length, so you can see that this interval, this RR interval, is shorter than the other RR interval. This is an RR interval that ends with a sinus conducted beat. Here we have another long interval, caused by the junctional escape pacemaker. Another short interval caused by the inclusion of a sinus conducted QRS. Another long interval, another long escape interval, and another short interval ending with a sinus conducted QRS. So a sinus conducted capture beat, and these sinus conducted beats are referred to as capture beats, will end the shorter RR interval, proving that there is no third degree AV block present. There could not be a third degree AV block present because these impulses are reaching the ventricles from the atria. Thus, there is no AV block. These arrows indicate the QRS complexes that are the result of a sinus conduction. Now, note how the ventricular escape rhythm, the long RR intervals, are interrupted by the sinus conducted beats, the shorter RR intervals. This cannot happen during a third degree AV block. Due to the AV block, there can be no interruption of the very steady, regular ventricular rhythm. Okay, time for pearl number 3. During AV dissociation, and that's any AV dissociation, whether it's caused by a junctional escape rhythm or whether it's caused by a third degree AV block, during any AV dissociation, a normal PR interval does not indicate conduction. A normal PR interval does not indicate conduction. It's a mathematical probability that the ratio of atrial rate to ventricular rate will occasionally result in a normal appearing PR interval. It's coincidence. That does not mean that it conducted. Never let anyone try to convince you of that. And note that all the P waves that did conduct had prolonged PR intervals. So the bottom line is this. There's a lot more to the definition of third degree AV block than just AV dissociation. If you're reading a book or an article or watching a video on the web that defines third degree AV block, simply by the presence of AV dissociation, they don't know what they're talking about. There is a difference between pure AV dissociation and AV dissociation caused by a third-degree AV block. Did you know you can learn more on my website and in my master classes? I'm Dr. Jerry W. Jones, and I teach master classes in advanced ECG interpretation, the master class in advanced electrocardiography, and the master class in advanced dysrhythmias. Both are 4-day, live, and in-person classes. Each master class is limited to just 20 participants. Now, there's active participation by all in both classes and time to ask questions, even during the presentations. You do not have to wait till the end of a session or a presentation to ask your questions. You may ask questions at any time. You can learn more about these master classes at my website, https://medicusofhouston.com. I want to thank you very much for your time and attention, and join me for my next presentation, Misinformation about Compensatory and Non-Compensatory Pauses. And before you leave, be sure to subscribe to my channel and click that like button. Goodbye.